Hi everyone, my name is Christine Zecca and I'm doing the Postbaccalaureate certificate program. I just graduated this past May from UNCG. I hold a Bachelor of Science in Nutrition with a wellness concentration. So for the wellness component of my degree, I took kinesiology and public health classes. I would like to utilize my undergraduate degree in fostering healthy aging in the older adult population. I'm not exactly sure how I want to do this, so I'm pretty excited to take this class and learn about the different options available and be able to help me hone in more exactly what I can do with it. I have some work experience and volunteer experience with this age group, and so for my work experience, I was a CNA at High Point Regional for 8 years. I worked in the rehab unit. Our patients had to do physical and occupational therapy. Many of them were elderly, as the patients we cared for had experienced a stroke, had cardiac issues, or possibly had a knee or a hip replacement. And a few years back, I volunteered at Pennyburn. And for those that may not be familiar with Pennyburn, it's a local retirement community, one of the continuing care community centers in High Point. And I did activities with those that were in assisted living that had the early stages of dementia. And for these patients, we did activities like bowling, bingo, trivia, sing-alongs. And I just noticed the difference in those that were engaged in the activities versus those that did not engage in the activities. And I realized some of that was the disease process, but I just, want to help with that to help foster getting them involved in activities, whether they're mental or physical. And I currently volunteer at Food Assistance Incorporation, which is a nonprofit organization here in Greensboro. It provides groceries once a month to low-income and disabled seniors, and some of them are able to come pick up their own groceries, but many are not. So I have had the privilege of delivering groceries to them, and we don't necessarily think of this population as being food insecure. We think of it more with families having children, but they also experience food insecurity, and many of them just want someone to talk to, give them an extra 15-20 minutes. A lot of them lack that social aspect in their life. And so between my volunteer and my work experience, I just realized that this age group has so much to offer. They have wonderful life experience, wonderful stories. I think I laughed every day I went to Pennyburn, and had many interesting experiences at work. And I would somehow like to help this age group to age as healthy and as functional as possible. And there's some personal interests. I'm not far off from this age group. And I also have parents who are in their 80s and starting to experience some decline in health, and be able to help them as they navigate this part of their life. And looking forward to this class, getting to know each of you a little bit better. And here's to a good semester. Thanks.